inviting me today, Noah. I am glad to be here to tell you more about my perspective of things in the dental hygiene world that I've been part of for over 40 years. I came into dental hygiene because I wanted to be a health professional. I wanted to help people. Dentistry was the avenue that I chose. I went to school in Philadelphia, Temple University, graduated, went on for my bachelor's, went on for my master's in education, and became an educator. Taught for about 5 years until my husband was transferred. With his corporation, we moved to almost every state, had a kid in almost every state, really only have 3 children, but with that, it became difficult to continue in this field because of the way that the dental hygiene licenses and licensure is set up, so unlike so many of the other healthcare professionals, where it takes so many hoops to jump through. Not only the written application, which is, there's a little time delay, but can be planned ahead if you know where you're going into the next state. With dental hygiene, you have to many times take a board, a clinical board on a live patient. That's a hindrance for anyone who wants to be mobile. Even now, as I'm older, we have the opportunity to be traveling and staying in locations for periods of time. Like, again, many other professions. I have friends who are physical therapists and nurses. They are traveling and easily taking their license and making it portable into any of those other states with an application process. Again, very a respectable question and requirement to have to be licensed in a state, but yet what would it take to be licensed in many of our states is unequal. Makes it so much more difficult. I've enjoyed living in Ohio. I've enjoyed being part of our professional association, helping to be a voice and mentoring graduates, mentoring students, helping those that I'm colleagues with to encourage them, to be encouraged by them, to be supported by them. I think we need to be supporting each other more and empowering each other more. I'm seeing way too much tearing down on social media. We have the opportunity to be building each other up, and that's the platform that we can be doing it, especially now.
Now, dental hygienists are usually unsung with the contributions they make to oral health care and the types of things that they do that are so critical to their patients' health. Can you kind of give a rundown of just some of the ways that you've worked and helped patients over the years, and then also why you feel that you've run into these roadblocks every time you've moved to a new state and had to basically restart your entire professional career?
To answer the latter part of your question first, it's the way that it's set up now. There are some initiatives being taken to make those changes, to somehow, I don't know how it can be done, let the masterminds figure that out. There are coalitions to bring about those changes, perhaps even eliminate the live patient in a board and make it more of a typodont, make it standardized from each state. It all begins with the voices of the hygienists. It begins also with the public speaking up and saying that we want more access to hygienists. We want hygienists to be providing the care that we so desire. So many of our public can't even reach hygienists because they can't afford the dentists, yet there are states that are successfully providing care to the public with the dental hygiene therapists. That's the way that a lot of them have been able to receive the care.
And access to care for oral health care is a big issue in this country. I think it's not talked about as much as it should be, but the stats I've seen are less than 50% of people have dental insurance, and that's a big thing that drives people to get to the dentist. And the two things people always talk about that keep them from going are the fear of the dentist, which, you know, that industry's working to get past that, but also the cost of going to the dentist. And if you're going regularly for your hygiene appointments, the cost is there, but you're also, you know, generally catching things early enough that the big expensive dental procedures that everyone's afraid of don't have to come around. So how do we help people get past that barrier? You mentioned, you know, sort of expanded function hygiene in certain states. Does that seem like a good path, empowering hygienists to see patients on their own for prophylactic and diagnostic services?
I believe that there is a safe way to provide that care. I believe a lot of dentists aren't aware of the training that's involved in dental therapists. I know that there are dentists that don't understand the training of a hygienist under his own employ or her employ, which is very sad because dental hygienists are very knowledgeable, very passionate about what they're doing, wanting to educate the public and not only bring education, but coach. We make changes by motivating. We don't make change by simply teaching. A hygienist is a great motivator, a great coach. No matter how much education you provide for someone, unless they're able to internalize through time spent and investigating what is that a problem that I can be helping you with, that's where change will happen. And our patients need that one-on-one extended time that we can provide, and we do provide, yet when we're bogged down with all the incidentals and tasks that really could be performed by other people, such as scheduling a future appointment or taking payment, things that are way beyond what should be done within that time slot that we're given, that's where it becomes unproductive.
Mm-hmm. Now, with the hygiene industry, you know, it's been in the news this year for a couple of reasons during this COVID-19 pandemic, and none of them have necessarily been great. Dental hygienists were among the largest workforces that were laid off during the start of the pandemic. I know not all those jobs have come back, unfortunately. And also, while this was not news to most hygienists, the general public probably wasn't aware before the pandemic that dental hygienist is one of the more dangerous jobs out there when it comes to risk of infectious disease, which has made dental hygienists in general pretty expert on infection prevention, asepsis, and all of the protocols that go into keeping a dental practice safe for care. Now, some of this has come to light, but we're both in the industry and we're familiar with this. How do we get that messaging out to help, I guess, empower hygienists in the minds of the general public so that there's a little bit more support for hygienists as solo practitioners and as the care providers that they are?
I think our professional association, the American Dental Hygienists Association, did an exceptional job on providing the documentation and the literature that really led the way in our industry beyond what the ADA, beyond what the CDC could provide for making sure that hygienists were going into a safe environment. The sad thing is that a lot of those materials weren't available. That's what made it more difficult. What else I believe made it difficult? I heard in an interview being labeled, not personally, but hygienists across, by a well-known public person in dentistry as being whining hygienists.
Mm-hmm.
That was totally uncalled for. If there weren't already an issue, I believe the COVID situation wouldn't have been as bad as it was for the dental hygienists. If trust had already been built, if trust had already been established, and the belief that we would be taken care of and provided for, there wouldn't have been the walkout of hygienists that there are. The number of hygienists that showed up to report to work and being told, yes, we have the materials, yes, we have the PPE for you, and then find out that it really wasn't there. That's deceptive, and that does not build trust. What I'm still seeing on our social media pages is there are still incidents of hygienists who, there's one that tested positive. She needs to be home. And now she received a text that said, I'm replacing you. There's no protection for hygienists. The labor laws are such that those that are in smaller offices don't have that protection from the labor laws to allow us to call upon and say, this is not allowed. And yet so many states are, the free will states that they can be fired without real reason. And yet there's no ability for us to call upon anybody to help us.
It sounds like almost circling all the way back to the beginning of what you brought up at the top of this discussion, that there needs to be sort of a national overhaul of, how the hygiene profession is handled both in the dental sphere and in the regulatory sphere, so that, do hygienists need a national overarching standard for their licensure and then some national overarching standards for their workplace rules?
I like what you said, Noah. I like that you said a national overhaul. I believe that's what it would take. It would take almost scratching the surface. That's to get down to what's really deep below. Get rid of all that's festering and clean that out. Begin with really looking at other nations and seeing how they've been successful in providing care to their public and to the citizens that have a payment option, those that don't have the payment options, and allow hygienists with, we don't want independent practice. Colorado has independent practice. Hygienists don't want independent practice. I know that, but yet we want to be able to practice and use the knowledge and the skills that we have without having the condescension. It's demeaning to be able to provide care and have that ability to coach and provide the transformation in a patient. I've seen it. I've witnessed it personally. And to have our hands tied and not be able to do that, I think a national overhaul is warranted. It would be very effective. I know there are powers that don't want that to happen, because with power also comes control. And there are some that just want to maintain that control.
Mm-hmm. Do dental practices have a financial motivation to limit the agency of their hygienists? And I know they look to hygiene as a production center for practice revenue, but if hygienists have actual more control over what they're doing, does that, jeopardize something on the financial side?
This will be my opinion.
Mm-hmm.
I believe it's all across the board. I think one practice could be of the mindset that there are practices that still don't even have hygienists. There's a dentist out on social media that says hygienists are profitable, if you can believe that. And yet then there are other practices that let's get hygienists do everything, everything. Let's have them do whatever they can in that scope of few minutes that we give them. They're going to be doing it all because doggone it, we pay them a good salary and we're going to make them work for it. That's because there was such a vast number of hygienists. There was a good pool to pull from. That pool has diminished. And that's because I believe that there were those underlying issues. We who had the option of not going back did not go back. And that's unfortunate, because now those patients that we're making headway with, that we're seeing changes in, are not going to receive the care that we could have provided for them.
Mm-hmm. In terms of just, the overall makeup of the industry, the dental hygienist population is still overwhelmingly female. And do you think that that's played a part? And, has there been, a misogynistic bent to how hygienists have been, I don't want to say necessarily specifically treated, but how they've been managed in the dental industry and how the, industry has positioned their role?
My understanding is there are 4% males in dental hygiene. Last
Yeah.
I heard the statistic, it might be up to 5, maybe 6% by now.
Yeah.
I don't know that it's been misogynistic, but yet I will clearly say that there has definitely been a male preference. I've seen it myself, have so many of the males, and I think there should be a research study. I haven't seen it myself. There should be a research study to see where are our males being placed? Where are the males working? Many of the males that I know aren't working clinically in private practice. They are working in administrative positions. They may start in the clinical, that's on their resume, and they work their way up through. And yet someone else who is of equal status, equal experience, etc., is bypassed. And unfortunately, it's the male that gets promoted. That is still existing. And that shouldn't be like that.
Do you think the fact that the dentists themselves, this year was the first year where more female students graduated from dental school than males, and that trend seems to be continuing. The dental workforce is growing more diverse in many ways. Do you think that can help hygienists gain the agency and the responsibilities that they can take a hold of and really expand what they do?
Unfortunately, I do not. I do not think simply because there are going to be more females licensed as dentists and practicing. I know that there are some female dentists who are hygienists first. I don't know of any male hygienists that went into dental school. I do know of several dentists, in fact, 2 in my own class back in the other century did go to dental school and become dentists. But even to go back to your other question too, Noah, you asked me about if there were more males. My personal opinion here again is we wouldn't have these issues with our licenses not being as portable as they should be if we had more females. I think if more males were licensed, or excuse me, if we had more males in our field, they would be able, they wanted to move from state to state to state. You can believe that these laws would have been changed by now. And it's sounding as if I'm making a distinction that, we women were trapped at home. Well, yeah, we were. We were the ones who were physically giving birth and raising the children, etc. Our time was consumed with that. That's what kept us from having our voices. There's a whole lot of that too, as well as having our voice silenced. There's a personality between men and women, and men will promote themselves above their abilities and for a position, and women will not think of themselves even qualified for the same position, and yet they would be equally. So we have those personality differences as well that play into it. And so it's not intentional. Some of it's just our mental makeup.
To kind of go back a little bit to the portability of licensure, when you're going state to state to, okay, we've moved, I want to restart my career in my new location, are the exams similar state to state? They're just requiring you to retake pretty much the same test you've already passed?
It depends. They've now become more regional. Back when my husband and I were relocating throughout the country, we had basically, for instance, I moved from the Northeast region, which was the Northeast Regional Board at that time, the NERB. I believe there were 13 or 15 states, which are all teeny tiny up there. That NERB board transferred between all of those states. Relocating down to Texas, Texas had its own board. We lived up in the northeast part of Texas. I had to wait until the next board, I don't even remember when it was months away before I could even take that board. Texas is a big state. We physically had to drive 5 hours to get to the University of Houston Dental School. It was during spring break. You go down not having a patient. I lucked out. Being spring break, patients weren't coming in. I lucked out. Somebody came in the front door that I was standing guard and hoping that I could find a board patient. And that's still true today, though. It is the luck of the draw, and it is a flip of a coin if your patient's going to show up. Hygiene students that are taking these boards are paying for the hotels, they're paying for the meals, they're paying for their patients to physically lay in a chair and receive free dental care. To have to provide that it's a lot of responsibility on top of the judgment of the board examiners, which, you know, they say they're fair, and yet anything could go wrong, and a patient could, you know, one wrong move and they failed. A state could be different in the set of examiners that go. They try to calibrate, but it's still so subjective. You know, a more objective way, we have that typodont, or I'm going to be brash and even say, just eliminate the clinical board. Why are they going to school and having all the clinical patients to be examined by the educators and be qualified? The schools are accredited, which means they have to pass the standards. Perhaps the people that should be taking the boards are the educators, and let them be the ones who are receiving the test to see that they're maintaining their skills. Once educators are working full time, they're not working in the clinics or in the offices anymore.
Mm-hmm.
I know that's way out there, but sometimes that's where ideas come from.
Yeah. If you know, portability was something that wasn't even an issue. A hygienist could practice wherever she or he wants to. They could move to a different state and start up again with a new practice. Do you see, I know there's some apps out there that are designed to allow dental professionals to kind of work like a Uber driver, a gig economy where the practice can hire you via the app. The app takes care of a lot of the back end stuff, but you know, you show up, do the job for that day or however many days, and then possibly move to a different practice. Could that work for hygienists? Would hygienists, you know, is that a job that can be done as a gig, kind of in and out, or do you need time at the same place to, you know, you mentioned educating your patients and motivating them. Does that work if you're in a gig situation and it's a different person taking care of you every time?
I've seen two different roles. We have hygienists who are temp hygienists who are called 5:30 in the morning, as I've been done in the past, say, hey, can you come in? So-and-so called in sick. That would be perhaps a one-time option. You have all the different software that has to be made, but offices accommodate for you. There's all kinds of ways to get around that. A person who's on the patient's end, we have those that say, where's Debbie? You're not my hygienist. Yeah, I'm not used to you. You know, I want my other hygienist back. As long as the patients are told ahead of time, hey, we have somebody new coming in, well qualified, a lot of times the patients really don't care. If there's the standard of care that's being provided routinely in the dental office, it shouldn't be an issue. It's picked up at the next visit. As far as going around through the country as well, for instance, a physical therapist would be on a 9 or 13-week call, 9 or 13-week duty. There's all that portability. The only caveat, though, is different states have different laws as far as local anesthesia. Mm-hmm. And for instance, I'm also an EFTA. So I have the local anesthesia certification, which is one thing. I'm also an EFTA, which is another thing. Nitrous oxide, again, which I also have, which is another thing. Not all states have that. Some states don't allow hygienists to do that, or if you wanted to transfer that, they don't allow it, etc. There are all those other little hanging ends that would have to be, those loose ends needed to be tied up, and that could be part of the national overhaul. They are learning it in school now, but if they were to transfer into a state that wouldn't allow local anesthesia, for instance, that would be an issue.
Mm-hmm. Well, Michele, this has been a really interesting conversation. Are there any kind of key points that I haven't asked about that you think are really important for people to think about when they're thinking about how to kind of improve the hygiene profession and make it something that is more accessible to both the hygienists and the general public?
I think the best way that we can continue to move forward is to support each other. Support your professional organization, become a member of it, pay your dues. If you can't attend the meetings, at least pay your dues. Allow your money to be used for the betterment of your profession. Move forward. Let's not tear each other down. Let's support each other. We truly are all in this together. And our voices can go a lot further when they're working the same way, working to help improve our public health, which ultimately we all know is our entire whole body health.
Well, wonderful. I really do appreciate you joining us here today. Thank you so much.
My pleasure. Thank you.